Reye syndrome is a rare disorder in which cells throughout the body become swollen and build up fats. In turn, blood sugar levels typically drop and ammonia and acidity in the blood rise. These changes may affect the organs and cause severe swelling. The liver may also swell and develop fatty deposits. Swelling may also occur in the brain. The pathophysiology of Reye syndrome appears as follows. It starts when a mitochondrial injury results in a dysfunction that inhibits oxidative phosphorylation and fatty acid beta oxidation in a virus-infected sensitive host. This host has usually been exposed to mitochondrial toxin, most commonly salicylates. Histologic changes then follows, including cytoplasmic fatty vocalization in hepatocytes, astrocytes edema, and loss of neurons in the brain, and edema and fatty degeneration of the proximal lobules in the kidneys. All cells will then have pleomorphic, swollen mitochondria that are reduced in number, along with glycogel depletion and minimal tissue inflammation. Hepatic mitochondrial dysfunction results in hyperammonia, which is thought to induce astrocytes edema, resulting in cerebral edema and increased intracranial pressure.
The following are considered as the predisposing factors of the syndrome. First are children and teenagers under 20 years of age, but is most common in children between ages 4 and 12. Second are patients recovering from a viral infection, most commonly the flu, chickenpox, or rubella. The symptoms of Reye syndrome usually begin a few days after a viral infection. These are the following. For children younger than the age of 2, the symptoms include diarrhea and rapid breathing. And for older children and teenagers, the symptoms include persistent or continuous vomiting and unusual sleepiness and lethargy.
No specific treatment is available for Reye syndrome. Urea cycle disorder treatment agents. Ammonia detoxicants are used for treatment of hyperammonemia. They enhance elimination of nitrogen. Sodium phenylacetate sodium benzoate is approved by the U.S. Food and Drug Administration or FDA for treatment of hyperammonemia due to urea cycle defects and is available only from a specialty wholesaler, UC Pharma Inc. Antiemetic agents. Antiemetic agents such as ondansetron are administered to decrease vomiting and during the initiation of sodium phenylacetate sodium benzoate therapy.
The following are the nursing diagnoses. Deficient fluid volume related to failure of regulatory mechanism. Ineffective cerebral tissue perfusion related to diminished arterial or venous blood flow and hypovolemia. Risk for trauma related to generalized weakness, reduced coordination, and cognitive deficits. Reduced breathing pattern related to decreased energy and fatigue, cognitive impairment, tracheobronchial obstruction, and inflammatory process.
The following are the tests that help confirm the diagnosis of the syndrome. Spinal tap or lumbar puncture can help the doctor identify or rule out other diseases with similar signs and symptoms. Liver biopsy can help the doctor identify or rule out other conditions that may be affecting the liver. Computerized tomography or CT scan or magnetic resonance imaging or MRI can help the doctor identify or rule out other causes of behavior changes or decreased alertness. Skin biopsy. Testing for fatty acid oxidation disorders or metabolic disorders may require a skin biopsy.